All right. Hello, today I will present a detailed analysis of the case study of Jennifer, focusing on her diagnosis, treatment options, and related information. This presentation aims to deepen understanding of borderline personality disorder, supported by current research. Please see the Zoom link in this slide for the recording of this presentation. Jennifer is a highly intelligent woman working in a university, but her personal life is unsteady. She's recently divorced with custody of her children. Her behaviors include risky online dating, seeking validation through attention, and pushing away men before they can reject her. She also has a trauma history, including sexual assault, which influenced her emotional state. Recently, her action led to a suicide attempt, highlighting her emotional distress and instability. A brief description of Jennifer Case. She's in her mid-20s. She's recently divorced with a complex dating behaviors, engaged in risky online dating, sharing revealing photos, seeking attention. And she also pushes men away before they can push her away. She has a history of childhood trauma and sexual assault, and recently suicide attempts. Jennifer behaviors align closely with the DSM-5 criteria for borderline personality disorder. She fears abandonment, has unstable relationships, acts impulsively, and shows emotional volatility. Her patterns of rapidly forming and ending relationships, along with self-harm and suicide behaviors, are classic signs of BPD. She meets multiple criteria confirming this diagnosis. Some of the diagnoses include fear of abandonment, unstable relationships, impulse behaviors, intense emotions. She rapidly attaches, then pushes away partners, engage in self-harm and suicide behaviors, experience intense feelings of emptiness and anger. Her patterns fit DSM-5 criteria for BPD. She has 5+ symptoms of BPD. The most effective treatment for Jennifer would be dialectical behavior therapy, which teaches skills to regulate intense emotions and reduce self-harming behaviors. Therapy also helps her process childhood trauma and improve her relationships. Medications might be used to stabilize mood swings or treat depression. Establishing a trusting therapeutic relationship is key to help with her progress. How can Jennifer be helped? She can be treated with DBT, focus on emotional regulation and distress tolerance, psychotherapy, psychotherapy to address trauma and relationship patterns. Medication may help with mood swings and depression. Building trust and safety in therapy are essential. Jennifer behaviors, such as her intense fears of abandonment, impulsivity, and emotional swings, place her in a cluster B, which includes disorder characterized by trauma, dramatic and unstable behaviors. Her relationship patterns and emotional response are typically a borderline personality disorder, confirming her placement in Cluster B and why it fits Jennifer. BPD is a part of Cluster B. Dramatic, emotional, and unstable. Shares traits like fears of abandonment, impulsivity, mood swings, her intense, unstable relationship, and emotional reactions of typical Cluster B. With proper treatment, many people with BPD can recover or greatly improve. About half of the patients see significant symptoms reduction within 10 years. Early consistency therapy like DBT increases the chances of remission. However, co-occurring issues like depression and substance abuse can make recovery more challenging. What is the outlook? Many improve with therapy over time. About 50% achieve remissions within 10 years. Recovery is supported by ongoing therapy and support. Early interventions improve long-term outcomes, and conditions can complicate recovery. Borderline personality disorder is relatively common, affecting around 1.6 of people. It is more frequently diagnosed in women and typically starts during late teens or early 20s. Many individuals with BPD also experience other mental health issues like depression or anxiety. How common is BPD? Affects 1.6% of population, more common in women, about 75%, usually begins in the late adolescence or early adulthood, often co-occurs with mood and anxiety disorders. Individuals with borderline personality disorder often face challenges in engaging with treatment, trust issues, intense emotions, reactions, and stigma can hinder progress. Additionally, co-occurring conditions like depression or substance use may complicate therapy. Despite these barriers, with patience and proper support, many can achieve meaningful improvements. Challenges and barriers to the treatment: difficult trusting others, leading to treatment dropout, emotional instability, making consistent therapy hard, stigma associated with personality disorder, and conditions like depression or substance abuse complicate treatments. Need for specialized long-term therapy approaches. Support for individuals with BPD extends beyond individuals' therapy. Support groups and family involvement can be very helpful. Resources like Crisis Hotline provide immediate assistance during times of crisis. Long-term management often requires a combination of therapies and social support to help patients maintain stability and improve their quality of life. Resources and support for patients, like Jennifer. Therapy options include DBT and MBT treatments, support groups and peer networks, family therapy and psychoeducation, crisis hotline and emergency service, importance of ongoing support and long-term management. Jennifer Cases clearly fits the diagnosis of borderline personality disorder. She can benefit from specialized therapy like DBT, which helps manage her intense emotions and behaviors. Recognizing her as part of Cluster B helps understand her symptoms with ongoing treatment. Many patients like Jennifer can lead healthier lives. Main points to remember: Jennifer behaviors match DSM-5 criteria for BPD. Treatment like DBT is highly effective. BPD belongs to cluster B. Dramatic and emotional traits, and also many individuals improve with therapy and supports. In summary, BPD presents with significant emotional and relations challenges, but is treatable with appropriate interventions. Accurate diagnosis guide effective treatment, especially therapies like DBT. Early and consistent supports can lead to meaningful improvements in patients' lives, promoting awareness and reducing stigma. Also, crucial in fostering a supportive environment for those affected. Key takeaways and final thoughts. Borderline personality disorder is characterized by emotional instability, impulsivity, and unstable relationships. Accurate diagnosis based on DSM-5 criteria is essential for effective treatment. Evidence-based therapies like DBT offers hope for improvement. Earlier interventions and ongoing support improve prognosis. Understanding and reduces stigma are vital for better care and support. And lastly, these are the main sources I use for this presentation, including the latest DSM-5, reputable books, and DBT and personality disorder. Hope you guys enjoyed this presentation. Thank you.